Hello, everybody. Welcome back to another episode of Professions in Med. We are your hosts. I'm Ayman.
I'm Gerald.
And I'm Akanksha.
Today, we are going to be diving into pediatrics and medicine. And to elaborate and answer some of our questions, we are joined by Dr. Paul Beaudry. Thank you so much for coming in today, Dr. Paul.
You're welcome, guys. Thanks for having me on.
All right, so I think to kick it right off, we'll just dive right into it with the first question. What does a day in your life look like? Like, what are the little things that you have to do, in as much detail as you would like?
Absolutely. So as you guys know, I'm a pediatric general surgeon. So I work at the Children's Hospital. My clinic is based at the Children's Hospital, and I do all my surgeries there. The vast majority of my surgeries there. Occasionally we work at the other hospitals. In surgical practice, people sometimes have their clinics on site with the hospital or sometimes out in their own facility or clinic that they run outside the hospital. But mine is fortunately built into the hospital, which makes it very efficient for me to be able to see patients, be in the OR, be on call at the same time. In addition, I have quite a bit of administrative work and I do some research work as well. So these are all the ingredients that go into any given day for me. So depending on the day, really varies what my day would be like. I think a very busy clinical day would probably be me going into either have an OR day, which starts at 7:30 in the morning and goes typically till 4 o'clock. I may or may not be on call that day and then be going to emerge between cases and seeing patients, maybe booking emergency cases to add on at the end of the day. Typical day of call ends usually on average, I can get home by 10 o'clock at night. It's pretty rare I got to be at the hospital late, but occasionally I am if it's busy or I have to come back to the hospital in the middle of the night to see a very sick child that might need emergency care. Other days I may be in clinic where I'm seeing patients in my clinic space, on call or not on call, and answering calls at the same time, but generally going through clinics, seeing patients and doing the dictation, the paperwork that goes along with that, making referrals, booking patients for surgery, making plans in that regard. The other things that get mixed into this are administrative work and research work. And I'm the site chief for surgery at the Children's Hospital. So I sort of have to troubleshoot and manage issues that come up with all of the surgeon, all the different specialties that work at the Children's Hospital, including orthopedics, neurosurgery, ophthalmology, ear, nose, and throat, dentistry, urology. There's a long list of surgeons that work at the Children's Hospital in different specialties. And I have to work with them and help make sure OR time's allocated. Troubleshooting happens when there's problems getting to the OR, all kinds of different things come up. So that kind of runs in the background. And then that administrative work also is something on some days when I have less clinical work, I'm not on call, then I can dive into more of the things that I need to do, preparing reports, having meetings with people about trying to fix things or look for ways forward, vision stuff where we're trying to improve the way we deliver care. Exciting stuff to actually think about what the future of medicine is going to be like. And then other days will be research stuff where I don't get over to the lab as much as I used to, but I support a graduate student as a PhD student right now, and I'm co-supervising her. And we have a lab that looks at solid tumor immunology, and we're looking at innovative T-cell therapies for trying to treat solid cancers in kids. So I try to work to write grants and get money to support that when I can. And but that's a collaborative effort amongst many people that I contribute a small part to.
It sounds like you're a man of many hats. You have a lot of responsibilities for you to take care of and a very busy work schedule for sure.
Yeah, and it's not where you want to start. When you start your career, you obviously pick your battles and you focus on certain things, and then you work up from there. But it's one of the exciting things about being in medicine is the opportunity for all of these things. And for many of my colleagues and friends, just the clinical work, and not to say just as if it's minimal, is something they really thrive on, and they put a lot of their effort into really expanding their capacity. I limit some of my clinical work. I don't do as much clinical work as some of my colleagues because of all these other responsibilities that I've taken on, but it's one of the things that's exciting about the field in general, not just being a surgeon, but a physician, is you can really customize your practice to the things that you really are interested in and want to do.
I guess a good follow-up question to that, and I have it written down here as well, is how do you manage that work-life balance? Because I'm pretty sure you have personal things you want to enjoy as well, and a lot of work to do. So what are some things that you do in your life to get that balance?
So I remember seeing an article on work-life balance some years ago, which I think captured it in one line better than I've ever heard. Is it's not a work-life balance, it's a work-life teeter-totter. it kind of goes back and forth. And there are times when work necessarily takes up too much time, but I'm aware I'm taken out of the bank at that point. Like I realize I'm getting into a state of mind and physical and mental and emotional fatigue that I'm drawing on my reserves. At other times, I do things that fill my reserves up, which are the other things that I do outside of work. Spend time with my family, spend time outside riding my bike. Over the last 10 years, it's become one of the best things in the world for me to take off for a couple of hours and go ride my bike, because then it just seems to fill up a tank that I have somewhere inside me that I can draw on when I need it. But it's important to identify the things that fill that tank, and for everybody they're different. And but you gotta fill it up, because there's times when the teeter-totter goes the other way and you're drawing on it.
Building off of work-life balance, what do you find is the hardest part of your job?
I would say, honestly, the hardest part is the system challenges. There's people that do a lot of work on physician burnout. And if we make that a surrogate for what the hardest part of our job is, because that's what can push us towards burnout, because it's a real thing. It's the vast majority of cases for all of us. It's not so much it's not so much the patient care or the research or the administrative work. It's the system and how it grinds us down, because the system at times requires this incredible input of energy to just achieve the goals that you want, which is good patient care, do your research work, your admin work, you want to get that done. But the system can create this background white noise that really draws a lot out of you. And when people that study burnout look at this in a really systematic way, it's clear that the systems we work in and the redundancies, the inefficiencies, the bureaucracies, the politics of those things, that's where we as physicians, we are depleted by that. And I think it leads us into, that can be the hardest part of the job for sure.
So you mentioned that, I guess, a big part of physician burnout is kind of the system and all the bureaucracy involved in being a physician. But I wonder, being a physician, you're often dealing with matters of life and death as well. So I was wondering if there was a really big emotional burden or sort of an emotional labor that was very present that you had to deal with in your day-to-day life.
Yeah, absolutely there is. And there are, depending on the areas you work in, like I can speak to being a pediatric surgeon, which, one of the things that's great about working with kids is they're resilient. They have an incredible ability to heal and recover from things. So you don't have very many situations where you're left feeling that you've failed somebody and they've been lost or their life has been lost, but it does happen. So those situations when we do find ourselves unable to save somebody, or they have and that can be anything from a trauma to an oncology patient that you work with for a long time, it does have an emotional toll. But there's some part of that emotional investment that makes us better at it, if that makes sense. The way it makes you feel to own what the care of that patient received is what makes you better for the next patient and the next patient and the next patient. So you grow from it. And it can leave you absolutely devastated. But I have to say, I've been fortunate to be surrounded by peers and family and people that support me in this. And they sort of give me the buoyancy that I need when those things really do get me down, because they do at times, but they feel like they're part of the job. Not to say it's like a job, but it feels like a natural part of what you're doing. And when you're striving to do your best and you recognize when things can't be changed and you lose a patient, it does take a toll, but it's like you grow from it, if that makes any sense. I know that's a tough answer, and it's one of these things I think you guys have to experience for yourself, but it's not a reason to not do something. The emotional toll that actual patient care takes on you is something that if you use it the right way, it makes you better at what you do.
Would you say that that would be a rewarding aspect of your job, or what do you think would be like the most kind of fulfilling aspect of your job?
Absolutely. Like when you take somebody who's suffering or has a health issue that they don't understand, you and you help them through it, you feel satisfaction. It's what we are drawn into medicine is that sort of a feeling that you want to help people, that you feel like you've got something to offer and you want to give it to somebody. And that's the simple way of putting it. But when that is fulfilled, and it is all the time in medicine, it definitely lifts you up. The rewards that you get from patients telling you that how much they appreciated the care you gave them are unbelievable. They're like gems in your treasure chest of life that you never forget. And I can think of the faces and voices and words that families have given me over the years for what I've done, and I'm grateful for that. But I think that the value of it really comes in fear, if I can say. Like, one of the things we do as physicians, even more than with our brains and our knowledge of medicine and biochemistry, pharmacology, physiology, we synthesize that into this skill. I've found, pound for pound, where I make the most impact as a physician is I can look at somebody and I can see their fear because they don't understand it. They're afraid of what's going to happen. And when you take the time to see that and you speak to them about it, and you try to find what it is about what they're going through that's scaring them. And I'm not a psychologist, I'm not a psychiatrist. This is just human connection. That's where you really realize being a physician is truly a privilege, because you are led into a place where you can help somebody through that.
I really understand that perspective. A lot of people come in and they have fears, and I'm pretty sure you've seen this throughout your career over the past few years. And I guess a question I can ask you pertaining to that is, you've seen a lot of patients come in. How is that? How has your practice changed, like from the first patient to the patients you're currently helping out right now? What experiences have you learned that have, made that job a bit more easier, or help you speed up your process?
Yeah, there's this thing in medicine that I think we have skill at, that is part of the process of getting into medicine, is you become really good at pattern recognition. And that pattern can be anything from a collection of lab work to words people are saying, to the combination of what words people say and to what you find on them. You get better from the very first patients you start to see throughout your career at pattern recognition. And some part of your medical practice, you become, I don't want to say quite computer-like, but you become quite dispassionate, and you can quite quickly get the information. You become very good at disregarding information you don't need and emphasizing information that you know to be important. And that just comes with experience combined with your knowledge, and always being willing to learn, because you got to keep going back and learning. The problem with what we learn is it becomes obsolete almost as soon as we learned it. So we got to keep going back and saying, has anybody looked at this again? It's an exciting time to be in medicine. It's a time when we have access to data on a scale that we never did before. Human experiences can now be quantified in a way that allow us to learn in ways that never could be done before, by virtue of social media, computers, just the way that the world is connected now and the way ideas are shared. I think it's going to accelerate it for people going into medicine now, that the learning curve is going to be even steeper. So I would say that that's been the biggest thing, is I'm now much more efficient than I was at the beginning at figuring out what information I need, what I don't need to pay attention to, how to get the information I need. And importantly, there's this thing that happens in the background that all physicians have to deal with. And this is also getting better, is you've got to have a way of cataloging, recording, communicating what your learnings are. And medical records are a whole thing where we're writing it down. If someone sends me a patient, I have to communicate back to them. This is what we talked about. This is what I think the problem is. This is our solution. I need to get them that information. Being very efficient and organized and keeping up with that is very important for patient care. And it's getting better all the time. It's starting to happen almost real time with some of the new patient care systems and electronic medical records we're using. So very exciting time to be going into medicine, where a lot of the system things I was telling you that burn you out, some of them are being addressed through technology. Not all, but some.
So building on that, what do you kind of see in the future of medicine or in your field, maybe in the next 5 years, 10 years, or anything that you're looking forward to?
Well, I think that medicine, and I'll speak specifically to surgery because that's where I spend most of my time thinking, is I think it's undergoing a revolution of sorts, because the way that medicine has been practiced throughout the years has had so much value in terms of this pattern recognition I've talked about. Learning what needs to be done for patients has kind of been passed on to us. People have put it in textbooks. We learn it. We try to understand it so that we can see a patient and recognize what was taught to us in the textbook. And that's a huge part of it. But even more than that, there's a lot of things that, because now we can study things differently. Now we know more. We can actually look and say, we used to think we always had to do that, but do we always have to do that? You can get answers to those questions far more quickly now than ever before. And I think medicine is going to be revolutionized in terms of us understanding what we're doing and why on a truly evidence-based level where possible, which I don't think medicine will ever be absolutely evidence-based, but it's getting better than it's ever been before. So I see us changing from a lot of thinking about, can I do this, to should I do this? And not being afraid of asking that question, which I think physicians historically have been a bit afraid to say, should I do this? Because they were told I should do this, so I'm just going to do that. But questioning it and saying, does this really need this? Do I need to do this? I know I was told to do this. I know the textbook said, but why? The generations of medicine that are coming through now are better equipped than ever before. It's challenging the status quo and looking for better ways to understand what it is human beings need to feel well. And that's a big part of what we're trying to achieve.
So I take it that medicine is generally headed in a more maybe holistic direction. Is that one way that you would put it? Or is it more of a scenario where medicine is reaching a point where suddenly like a bunch of ethical dilemmas we've never had to consider before are popping up?
I think both. It's holistic in the sense that encompassing all aspects of medicine, the care of the patient from their emotional state to their actual physical problems, which surgery is necessarily involved with sort of physical tactile problems, but our understanding of what the value of that is to patients. So the challenge that I would say that the next generation of physicians, I have to give to them, and I hope to have some of this figured out before I'm done, is what's the value to kids in Southern Alberta of any given operation that I do? So how do I compare a kid that needs ear tubes for ear infections to, say, a kid that needs complex dentistry and needs an anesthetic for that versus a kid who has a hernia? What's the actual value of these things, and what does it mean to healthcare and society? We don't have a metric for measuring these things. We've got physicians in each of these areas and people that work in these areas that say, well, it's important we fix this because healthcare, as you know, is in crisis worldwide. There's more healthcare being delivered than can be afforded. It just can't, it's not a sustainable system. We have to look at the healthcare, and there's not more money coming into it. We have to look at the healthcare we deliver and have a better understanding of what's it worth? Like, what are we really achieving for human beings by what we do? So if that's what you mean by a holistic approach, by truly understanding what the impact of what we do as physicians on not just our patient, but on all the patients, on the system, on what the state of health of our society is something that I think being a physician in the coming decades is going to be very exciting and part of a great change.
And I guess since we are approaching towards the end of the interview, I'd like to ask you one important question. I think every student who is in med wants to, get this. What one piece of advice would you give the students who are interested in pursuing this profession?
I would say that success in this profession, and that includes everything from passing the tests to surviving the nights where you're being asked questions you don't know the answer to being a good doctor one day, takes some passion. So I think that it takes a serious look at yourself about why you want to do it. And I remember being absolutely, I was driven to understand how human beings work. I couldn't understand it. I just could not understand it, and I wanted to know. But it made me passionate as a young man to know more about that. And I think that if you're driven by those things, then this is a great field to be in. But even after you get into it, you need to listen to your passions. There will be political things that may skew your interests or where you would direct yourself. You have to listen to your heart. Your heart speaks truly about these things. Some people will say, I don't want to work nights and weekends. People tell me that's no good. But at the same time, their heart's telling them, that is so cool when I get in there and something bad's happening and I can figure it out quickly and I solve that problem. You've got to be honest with yourself in those situations, and that takes listening to your heart, which to me is about passion. So I tried to not like things that were going to mean a bad lifestyle, but the lesson that I learned over the years is that the things that matter, and you have to be honest with yourself about it. Listen to your heart and you'll find your way through this profession, and the rest takes care of itself. Success in the exams, getting through the tough nights, finding a good job and being part of a great group where you feel really supported and doing a good job. It's all about listening to what you really want to do, not what other people think you should do or what society tells you maybe you should do. You need to be honest with yourself and you'll be successful.
All right. Well, thank you again, Dr. Beaudry, for coming today. And thank you everyone for listening to this episode of Professions in Med. If you have any comments and suggestions, please let us know. Until next time.